This webinar is brought to you by Leading Sheep in the Department of Agriculture and Fisheries. My name is Nicole Salua and I will be your facilitator for today. Our presenter is Dr Sandy Adsett, who is a Veterinary Officer for the Department of Agriculture and Fisheries based in Toowoomba. Welcome, Sandy.
Hi everybody, thanks for joining us. As Nicole said, today we're going to cover a little bit about the Clostridial diseases. Clostridial diseases are caused by anaerobic bacteria, which are widespread in the environment, particularly in soil. They produce spores which can survive long-term in the environment, and the disease is often fatal. The ones that we're going to touch on today is tetanus, blackleg, black disease, malignant edema, and pulpy kidney. Botulism is also another clostridial disease. However, that's already been covered, so we won't be looking at that today. So first of all, we're going to be looking at tetanus. Tetanus bacteria are found in the soil and the intestinal tract. It enters through wounds and it has an incubation period of 10 to 14 days. The spores of Clostridium tetani grow in poorly oxygenated tissues where they multiply and produce a toxin which affects the nervous system, and these cause the typical muscle spasms that we see. Horses and lambs are the most sensitive, and this often follows docking or castration. The toxin causes tonic or sustained contractions of the voluntary muscles, and these contractions are often brought on by touch and sound. And these images just show you some of the typical signs that we may see. These two lambs, you can see how rigid the limbs are, and often you'll see the head bent backwards like that. This is what we call the typical sawhorse stance. As you can see with this pony, the front legs are out in front and the hind legs are out behind it, giving that sawhorse appearance. This is also another classical sign that we may see in dogs. With the contraction of the facial muscles, it gives it this quite a bizarre grin. So some of the other clinical signs that you may see in your animals is stiffness and reluctance to move, and that's normally one of the first signs you may see. You may also see twitching and tremoring of the muscles, and they also get what they call a locked jaw, and probably most people have heard of that. It's where the jaw doesn't open as much, and that's a result of the spasms of the muscles of the jaw. You also get a prominent third eyelid, which is what this picture here is showing. You may get an unsteady gait, and often the tail is held stiffly out behind it, and as you can see in this goat here. The animal may be anxious and easily excited, particularly by sudden movements or handling. In cattle, bloat is common as the rumen stops working. You also may see an increased drooling as the animal is unable to swallow as well. And later on in the progress of the disease, the animal may collapse. It'll lay out on the side with its legs out stiff, as you can see in this. Often the head will be bent back, they'll spasm, and they'll die. With prevention, the main aim of prevention is vaccination. Usually you give an initial dose, which is a priming or sensitization dose, and that's generally given to your lambs, calves, or kids at marking time, and that stimulates an immune response. Then you need a 2-week period post that first vaccination before you start to even get a level of immunity or a level of protection. But maximum protection, it's not achieved until the second dose is given, which should be 4 to 6 weeks after that first dose. And that results in the protection for up to 12 months. In the adult animals, use cows and does, it's recommended that you give the annual booster 2 to 3 weeks prior to lambing, calving, or kidding. What that does, it not only protects your adult, but it also protects the offspring for approximately 8 to 10 weeks of age. The other thing you need to always consider are clean surgical procedures, such as your castrations, doing them in a clean environment, using disinfectant to clean your instruments, and that will significantly reduce the risk of tetanus. And you can also use an antitoxin, which can be useful, has a short-acting preventative if used at high-risk times. And this chart just shows the level of, when vaccination is given, the level of immunity that's received. and the build-up. Okay, any questions?
Thanks, Sandy. We'll just give people, so now's the time if you do have any specific questions about tetanus in particular, if you'd like to either raise your hand or type them into the question box. So just while we're giving people a minute or so to think of a question or to start typing it, we did have a question email in to us, and that was to do with tetanus, and so I'll just read this one out, Sandy, and if you'd like to comment on that, that would be great.
Okay.
So, to get the best tetanus cover, you are supposed to enter in an annual vaccination program. However, some people are only vaccinating once at landmarking to cover landmarking tetanus. Would you like to comment on that, please?
It would cover landmarking, but unfortunately you wouldn't have a level of immunity to provide any further ongoing protection, so it would be extremely short-lived, and yeah, your risk for tetanus is still significantly high if there's any injury or trauma at a later date. And those, if you're not vaccinating your adult animals, then your lambs have no immunity up until that time of marking when you give the first vaccination. As I said, you need the second vaccination provides the maximum protection for your livestock.
Cool, thank you. We've got a couple that have come in, so I might just ask one of those, and then we'll leave the other ones for hopefully we'll have some time at the end, and we'll come back and try and answer any of the questions that we haven't got to. So the question is, can you treat tetanus if found early enough?
Treatment, people have tried to actually treat horses. It's extremely expensive and without a lot of success. Very difficult. A lot of it is supportive therapy, and unless you had an extremely valuable ram, stud ram, economically it probably is not viable to try and treat.
Yep. Okay. Thanks. We've got a couple more questions there, but I'm just conscious of our time because I know you've got 4 other diseases to get through, so we'll keep going. Thanks, Sandy.
Okay. Okay. The next disease that we're going to have a quick look at is blackleg, and that's caused by Clostridium boviei. Blackleg, it's an acute, highly fatal disease. It affects cattle and sheep, and the spores are found in soil and the intestinal tract. The spores remain viable in the soil for years and are thought to be a source of infection. And outbreaks of blackleg have occurred on farms where there's been recent excavations or after flooding. You can also find the bacteria naturally in the intestinal tract of animals, and it's thought that they're ingested, that they pass through the wall of the gastrointestinal tract, they enter the bloodstream, and then are deposited in the muscles and other tissues, and they may remain dormant in the muscles indefinitely. In sheep, it's usually the result of a wound infection or an injury, and may follow something such as castration, shearing cuts, docking, or crutching. Whereas in cattle, often there is no history of a wound, although bruising or excessive exercise can precipitate the disease. And often you'll see it in beef breeds in excellent health, which are gaining in weight, that are most commonly affected. And in cattle, it can occur between 6 and 24 months of age. However, it has been known to occur in animals as young as 6 weeks or as old as 10 to 12, and may occur in summer and autumn. Okay. In cattle, often the onset may be sudden, and you may not see any signs at all. You just may find them dead. However, if they are alive, some of the findings that you might come across are an acute severe lameness and marked depression of the animal. In the early stages, their temperature may be increased, and they also may have, it's a characteristic fluid-filled tissue, so it's what we call edema, and it may be, when you feel it, it feels crackly, and these swellings will be hip, shoulder, chest, back, or anywhere there's muscles. The swelling is small, hot and painful, and however that increases with progression of the disease. There's a decrease of blood supply after a while, and the skin then over those lesions become cold and sensitive to touch. And after a while, the animals will go down. death occurs usually within 12 to 48 hours, sorry. And while the muscle lesions are the most typical, some cattle, you may only see the lesions in the heart and the diaphragm. When you do see the lesions, the muscles are dark red to black, dry and spongy, may have a sweet smell about them, and may be infiltrated with small gas bubbles. Okay, with again, prevention and control, vaccination in cattle, generally vaccinate at 3 to 6 months of age, vaccinate twice, 4 weeks apart, followed by an annual booster. It takes to 10 to 14 days before you get any immunity occurring. In an outbreak, all susceptible cattle should be vaccinated and can be treated with penicillin, and cattle moved from affected pastures. With sheep, lambs should be vaccinated, again, 4 to 6 weeks apart at marking and weaning, and then given a yearly booster, 4 to 6 weeks before the period of greatest risk. And with ewes, vaccinate 2 to 6 weeks before lambing, and that'll provide protection for the ewe and the lamb. Anything coming onto the property, naive ewes, should be vaccinated as well. Also, to help prevent and control blackleg, the carcasses should be destroyed by burning or deep burial in a fenced-off area, and that will limit the heavy spore contamination of the soil. Also recommended that you don't open the carcass or drag it along the ground. Other measures you can use as well is prevent overcrowding at feeds, and that'll help reduce your bruising and minimise rough handling, also to decrease your bruising. And again, clean equipment when you're doing anything. Okay. Any questions?
Sure. Thanks, Sandy. We do have one question about blackleg, and do you happen to know if it affects goats as well?
To be honest, you don't come across it very often, but there's no reason why it actually wouldn't affect goats either. But I've not seen it. I've not seen it in a goat, but that doesn't mean to say that they wouldn't be affected.
Yep.
But I can certainly provide more information on that at a later date if that person would like.
Sure. Thanks, Sandy. Yep. Do you want to continue on?
Okay. So the next one we're going to have a look at is Black's disease, and that's caused by Clostridial novi. And again, an acute, highly fatal disease. The bacteria found in soil and the intestinal tract and livers of herbivores, say cattle, sheep, things like that. And you can also find the bacteria on the skin surfaces and dormant in muscles, and so that also becomes a potential source of wound infections. However, typically, Black's disease is associated with the migration of immature liver flukes through the liver, and it does affect mainly sheep of all ages and cattle. Fecal contamination of the pasture by carrier animals is the most important source of infection. And as I said, the organism, it multiplies in areas of liver death, and that liver tissue death, I shouldn't say, and that's generally caused by the migration of liver flukes through the liver. The bacteria produces a powerful toxin, and that causes further tissue death and liver damage. Again, just waiting. Again, you rarely see clinical signs in animals, and cattle are often found just dead. In sheep, the animals are often 2 to 4 years old. They tend to lag behind the flock. They lay down and die within a few hours. And most cases occur in the summer and early autumn when liver fluke are at its peak. And the disease is most prevalent in well-nourished adult sheep. And as I said, it seems to be limited to animals which are infected with liver fluke. And these pictures just show adult liver fluke in the bile ducts in the liver. Okay. Prevention and control, there's no treatment for Black's disease. Prevention is the main thing that you should concentrate on, and an appropriate fluke control program combined with an appropriate Clostridial vaccination program is important in controlling this disease. You can get long-term immunity produced by one vaccination. However, only new and then after that, only new introductions to the flock need to be vaccinated. Partial contamination can be minimised by proper disposal of your carcasses, and that's burning is probably the best method. Any questions?
Oh, thank you, Sandy. Just while people might be thinking of questions or typing them in, we've just had someone comment that they looked it up in assuming a book about diseases of the goat, and it says goats can get blackleg, but they're less susceptible than sheep. So
sorry, I missed. Okay, I missed that. Sorry.
Yeah, so goats can get blackleg, but they're less susceptible than sheep.
Mm-hmm.
Yep. So thank you for that. So here's a question for you. Are there any external signs of the disease before?
Yeah, you're actually breaking up, Nicole. I can't hear you, sorry.
Are there any external signs of the disease before near death?
Can't hear you.
You can't hear me? Okay, we'll just continue on. Thanks, Sandy.
Okay, well, I'll talk about malignant edema. It's caused by Clostridium septicum. It, again, is an acute, generally fatal toxemia, and it affects all species and ages of animals, and is usually caused by the Clostridium septicum. The organism is again found in the soil and intestinal contents of animals. And these pictures just show swollen lymph node in a cow, discoloured and slightly swollen head of a pig, and swollen head of a sheep. Infection usually occurs through the contamination of wounds containing devitalised tissue or soil, or through the activation of dormant spores. And horses and cattle may have dormant spores already present in the muscle. Wounds caused by accidents, castration, docking, insanitary vaccination, and during birthing process may become infected. Toxins are secreted, or the Clostridial toxins cause local and systemic signs of death, and often result in death. The toxins secreted by the bacteria causes the cell death and disrupts the cell function, and that just leads to excessive inflammation, which leads to the edema and tissue death. Clinical signs may be general, and you may see anorexia and a high fever, as well as local lesions, which develop within about 6 to 48 hours after the injury or activation of the dormant spores. The lesions are usually soft swellings that pit on pressure and extend rapidly because of the extra cells and fluid moving into the area. Pitting edema is represented in this picture. You can just, hopefully you'll be able to see it. You can see the bit of a depression, and that's probably from a thumb, and when you press down, it stays down. It doesn't bounce back, and it'll be soft and sort of doughy. The muscles generally that are affected are dark brown to black in colour, and they may have accumulations of gas in the tissue as well. The muscles that are infected are extremely painful and may result in a systemic toxemia. And you may lose the skin over the area of an infection. You may see also severe edema of the head in rams after they develop infections of the wounds after they've been fighting. And you can also see malignant edema with lacerations of the vulva if there's been some trauma during delivery as well. And those animals may die within 24 to 48 hours. Yeah. Again, vaccination is a big key to controlling the disease, preventing and controlling. In endemic areas, you should vaccinate before you do any surgical procedures. Give 2 doses. I've got 2 to 3 weeks apart, but in a combine, you would give them 4 to 6 weeks apart at lambing and marking as well, and then give an annual vaccination in a high-risk area. You should also revaccinate if there's been some severe trauma, and where possible, keep your rams separate so that they're not fighting. Okay. Any questions?
Can you hear me okay now, Sandy?
Yeah, I can now, yeah.
Cool. Excellent. So does anyone have any questions about that particular disease before we move on? We might just move on, Sandy. There are a couple of questions which are related to the couple of other diseases when you couldn't hear me, but I'll save them until the end. So if you want to continue on, that'd be great.
Okay then. Okay. Next one we're just going to quickly cover is pulpy kidney, and that's caused by Clostridium perfringens. It affects sheep, goats, and cattle. Most common in rapidly growing lambs, either weaned or unweaned, that are put onto lush pasture or grain. So what happens is when sheep are moved on to lush, rapidly growing pasture cereal crops or fed grain, there's multiplication of the normal intestinal flora, and that in older sheep it also occurs after they've been moved from poor feed to good feed. And what it is you get a sudden change to a low fibre, high carbohydrate diet. So you get this multiplication and that of the bacteria, which then results in the production of the toxin. Prognosis for affected animals is poor. Therefore, again, prevention and control is paramount. So routine vaccination should be considered. If you have an outbreak, though, you should vaccinate all your animals immediately and give a booster if previously vaccinated. You also need to change the diet to a poorer feed or hay. Without a change in diet will usually stop an outbreak, but without the vaccination, you could get the disease again later. If you don't vaccinate and the diet's not changed, you could have as high as 10% mortality in your flock, and it'll usually be your best sheep that'll die. On post-mortem, if you do post-mortems at home, you may see some fibrin in the pericardial sac, so that's the sac around the heart, may see some fluid, and strings, very sort of length and thicknesses of a white to sort of yellowish stringy material that breaks apart real easy. That's the fibrin. Also, the lungs may be wet and heavy, and if you cut them, you may have a bit of fluid coming out of the lungs. You may also get some changes in the brain as well. This is pretty dramatic picture, but it also destroys the tissues within the brain, so you may get a bit of darkening of the matter, brown matter. And it's a bit difficult to test on farm, but in a laboratory they also look for how much glucose is in the urine as well, and that can indicate pulpy kidney. Okay, any questions?
So that's the end, I guess, of the formal part of the presentation. So now's your chance, if you do have any questions about either pulpy kidney or any of the other previous diseases Sandy has covered, please either type them in now or raise your hand. So Sandy, we'll go back to some of the questions that were asked previously. So I do have a couple more about tetanus. And one is, in terms of signs for tetanus, do the hooves/feet tighten up, roll back with tetanus?
How do they mean roll back? Sort of, because the rigidity, like the limbs are really quite rigid, so it would be, you can imagine being particularly stiff, that natural sort of, they would, pull up a little bit, if that's what they're referring to, not rolling under.
Yep. Okay.
Does that help?
Yep. Yeah, that's fine. If that person, if that's not what they were after, if they could just type in again or email us afterwards, and we can try and explain a little bit more. And also there was another question, and it was about the Black's disease, and are there any external signs of this disease before they're dead?
You may not see anything, but potentially if you've got a large amount of liver damage, you may see a little bit of yellowing, but that would be more of a chronic or a little bit longer term. In an acute disease, you just may not see anything.
So you're not likely to see any external signs besides finding them dead, or if you cut them open.
If they're really acute. Yeah. If it's a really acute, yeah, because it is an acute disease. So yeah, chances are you may not see anything. As I said, normally with a liver disease, you may see yellowing and that, but that's usually more of a chronic process rather than acute.
Yep. Okay. And so we also had a few questions that were sent in to us prior to the webinar, and so I'll ask a couple of those. So if your lambs are vaccinated at lamb marking and weaning, are they still covered, 7 or so months later?
Yes, they would. Yes, they would be. Normally your vaccination, that vaccinating twice, that 4 to 6 weeks apart, will give you 12 months protection. So yes, yep. they would be protected at that time, at that age.
And then another question was, should you give 5-in-1 to sheep when continuously feeding pellet thin or cotton seed to give extra cover if they only get vaccinated twice, once at lamb marking and then at weaning?
So just say that again, sorry.
So they're asking about, so they're only vaccinating their lambs at lamb marking and weaning, and so then they're asking about whether they should revaccinate them, particularly if they're feeding them.
If they're not vaccinated, the risk is after 12 months, those animals would then be susceptible to the diseases. So to ensure ongoing immunity, then yes, they should be vaccinating every 12 months. If they're used to grain and that sort of stuff, probably the chances of developing pulpy kidney in that are a lot less, unless they had a sudden change in diet. But definitely the ewes should be done yearly as well prior to lambing. So I suppose it depends on what you're actually doing with your lambs if you're keeping them on farm after that 12 months. Then you should probably consider a yearly annual vaccination program with them to protect them.
Yep. And then there was a second part to the question which you've just answered, but it was, should we give a booster shot to ewes, particularly in drought times when feeding?
Oh, I would definitely just do them routinely prior to lambing, regardless of the season. But in a drought, I guess the thing is, in a drought situation, you're more likely to be feeding, you're feeding your grains and that. So yes, they're probably at a higher risk, and particularly initially when you start feeding of pulpy kidney, when you change them from a poorer feed to a better feed.
Sure. Just conscious of the time, so we'll just answer 2 more questions. And this one I'm not sure whether you'll be able to answer, Sandy, but it's like how prevalent is it that lambs get tetanus at lamb marking?
Off the top of my head, I don't know the statistics, to be honest. That would be something that I'd have to research. Sorry.
That's all right. And then we've got someone down here with their hand raised. So John Hardy, I'm just going to unmute John, and if he wanted to ask his question. Mm-hmm. John, go ahead.
Hello, Nicole. Just wondering the time frame you got to work in vaccinating ewes prior to lambing. How far before lambing can you go before it comes to be sure it's going to work? Pass it on.
Yeah. Well, the recommendation is the 2 to 3 weeks prior to lambing to give that the best immunity with the antibody production and transfer through the colostrum. That's the peak. That would be the peak. Again, I'd actually have to sort of look at current research as to how far out that would extend. But as I say, ideally, and it's recommended by all manufacturers, that 2 to 3 weeks prior is the best. That's the best time.
Okay, thank you.
Yeah. John, we'll have a look at that and see if we can find, how far out you can give it.
Yeah.
So,
how far is John considering? How far out is he considering giving it?
About a month or 6 weeks before when we're shearing.
Oh yeah.
Yeah, it has to be 6 weeks before. It has to be 6 weeks before we shear. Better to shear before lambing anyway. So.
Yeah, so 6 weeks prior to shearing, to lambing. Yeah.
Mm-hmm.
Okay, I can look some stuff up for you, John.
Thank
to
you.
actually see what sort of studies and that are out there and how effective that they think that is. You would certainly have immunity in your ewes, no question about that. But antibody transfer, yeah, not 100% sure about.
Yep.
Thank you. So we'll send some information around about that particular question. Well, given the time, Sandy, I think that might do us for questions today. Any questions that we haven't got to, we will respond to people via email, or if you do think of a question afterwards, please feel free to email either myself or Sandy. The email that I send around shortly will have both Sandy and my email address on it. So Sandy, we might just come back to you to wrap up this question time and just to provide an overview of some key points that you want people to take away from your presentation about these clostridial diseases.
Okay. Mainly the most important thing that the clostridial organisms are normal intestinal and soil flora. They mainly become problematic when you have dietary stresses, injury, changes in management, parasites such as the liver fluke or other unusual circumstances, because they need that favourable growth environment. They all result in the production of potent toxins. They all carry a very poor prognosis, and the first signs of illness just may be death. Treatment success is rare, and so therefore you really need to consider your preventative measures, and vaccines are an efficient way to help reduce your losses. As we've sort of said a few times, a single vaccination doesn't provide adequate levels of protection, so you do need your 2 doses 4 to 6 weeks apart, and then an annual booster for coverage. And that's it.